Good evening, ladies and gentlemen, and especially Dr. Preetham Majumdar. And thank you very much for interacting and calling us here. Well, my name is Dr. Colonel Anil Kakkad, and I was diagnosed with Parkinson in January 2004. That's a nearly 18-year plus. And for first 10 years, I was only on agonist and all, dopamine. And after 10 years, means in 2015 December, I was added with Sindopa. And Sindopa and last year in June, I was operated for DBS. For those 4.5 years of period, my dopamine requirement kept on increasing, and in year 2020 I noticed first time that I was going into the off stage. The moment I used to take Sindopa, within 15-20 minutes or half an hour maximum, I was back into the on stage. Then I decided it is too much. I can't live this type of a life. That life is totally dependent. And then I was introduced to. Then I came to know. Of course, I was doing a lot of surfacing and internet searching and all. Then I found about DBS surgery. So I interacted with a couple of neurosurgeons, Dr. Doshi, Dr. Guru Prasad, and Dr. Preetham Majumdar. And then sometime and then the COVID was there, and unfortunately in March last year in January last year I was diagnosed with cancer of prostate. So obviously cancer got a priority, so I got operated and my prostate was removed, and luckily I'm out of 100% successful surgery, and though I'm on follow-up, but I got rid of that problem. And then I decided that since I can't live this type of life, so I decided DBS and underwent DBS, and last year on 16th June underwent surgery. And it's been exactly 11 months, and I find that this has been a real game changer. Now my off in last 11 months, I have not had any time off stage. And then my medicine requirement has come down. Right now I'm just taking one tablet of amantadine, half morning, evening, Sindopa 120 milligram and one restagilin, that's all. So precisely I'm taking 3 tablets in a day, whereas before surgery I was taking almost 1,400 up to 1,400 of Sindopa. Though luckily I very rarely used to have dyskinesia, but the off period was very distressing and very, well, I still say that DBS is a real game changer, but the importance of exercise is very important. Unfortunately, at present in Parkinson is a disease with there is no medicine to cure. And DBS has its own plus and negative points. DBS will not stop the Parkinson. That should be very clear to all patients, each and every patient. It will not start the progress of the disease, the natural course of disease, but exercise is the only thing which can, being a neuroprotective, it delays the disease. There are a lot of studies which shows that exercise is very important, and especially after DBS surgery. And I have noticed that I do regularly about 1.5 to 2 hours of, it has become a part of life now. If 1 or 2 days I don't do exercise, I feel lack of energy. All problems starts by aches and pain and all. But if I keep doing exercise, well, I'm nearly normal. The new normal or whatever is there. So, and right now my current is 2.5 on both sides. Well, and in the last I'll convey to the other people also, those who are on the fence. Go ahead, there's nothing to worry about DBS. It's a I had no problem. It's a surgery which lasted for 4 to 5 hours, and I thoroughly enjoyed the surgery because I was chit-chatting with the surgeons and all. I never realized that I am undergoing the surgery, to be very honest. I remember each and every step of surgery. When doctor the neurosurgeon was operating, I was just cracking jokes with him, and I don't know how the time passed.
So what is your feedback to the patients?
My feedback is, if you have been advised by the, don't see the problem in DBS. Everybody is not eligible or a patient for DBS. There's a window of opportunity. Please don't miss that window of opportunity.
Ma'am, as a caregiver, what will be your opinion about DBS pre and post? How the changes you see?
I am Brigadier Sunita Kakkar, and I'm an oncopathologist. Anil has had he's had the DBS surgery last year in June, and he was diagnosed with Parkinson's diagnosed somewhere maybe in May, June of 2004. It was in January 2004 when I first noticed that he had tremors at rest. So after we'd been to a number of our colleagues and friends and who kept saying this is intention tremor and you're anxious and anxiety, etc. Finally, we were always suspecting that it could be PD, Parkinson's. Finally, our colleagues also confirmed that. And as Anil has already said, slowly over the years from 2004, about say May, June, climbing right up to December 2015, he was on drugs like Ropac and Racegiline, Amantadine, etc. It was in December 2015. At that time I was posted in Chandi Mandir. That is the place where he was started on Syndopa. And Anil was told that it's high time that you start taking dopamine because now you need it. Because he was, at that point he had started getting more of stiffness and the tremors had practically reduced. It was stiffness which was beginning to bother him. And that Syndopa, I would say that over the years, as Anil has said already, there were days when he was taking 1400 milligram. His prescribed dose was not 1400 milligram. It was 1 tablet 4 times a day and 1 CR at bedtime, and with an advice that you take. So dopamine gives you that high. Is it that, the electrical current, or is it that the disease is progressing? I would sincerely request that please look into this and please give caregivers the answers on how to deal with this issue. Another good thing that has happened, after all of this, another good thing that has happened with DBS for Anil, before the surgery, he had very fragmented sleep. He would sleep 1.5 hours from 10 to 11:30, then be awake till about 1:30, 2 o'clock in the morning, then sleep for another half an hour, 45 minutes. So he had very fragmented sleep. So obviously in the awake periods, what do? The rest of the household is sleeping. So what do you do when you're awake and everybody else is sleeping? You put on the TV, you put on the internet, you start eating. So those things, those were other problems. Pre-DBS, post-DBS, his sleep has improved. So I must share here that after we came to Dr. Majumdar, he has adjusted, Dr. Majumdar, he adjusted the current and the point and the electrodes from where it is exiting out and moving into the brain, and there has been, I would say, a calming effect, and I would say an improvement in Anil's, general, that hyperness and that constant sense thing of being on a high. Definitely after your intervention, and you reduced the current substantially after we came to you, you changed the positions from where the current, what I understand in total layman language, from where it exits out and enters into the brain, you change that.
Course of the disease will go. And I'm the last person who knows everything about medicine that I'll pop up unnecessarily. I was advised to take 2050 milligram DBS QID plus 1 CR of 250. So it comes to 1250.
So you feel before and after the DBS, your Parkinson's
No.
improved?
Parkinson has
and
improved tremendously. That off
I'm not
stage.
saying that.
I know.
agree with that.
Oh, child.
No, I agree with that.
Okay,
His
let
off
me
stage
talk
is
now.
gone, his freezing is gone, his sleep is gone.
So
But
ma'am
there
is
are
agreeing
other
with that,
issues.
that after DBS you improve from the
No,
Parkinson's.
no.
right?
What she's talking about personalities or imagination, because I know myself. I was always like this.
Okay, ma'am. So, yeah, you
I'll
please
come,
tell.
no, we'll come back.
आप बोलिए आपको क्या feel
I
है?
am Lalita Gandhi, working as teacher. I got brain tumor in 2004 and I got surgery in 2004, brain tumor, and after that in 2011 मुझे कुछ tumors feel हुए थोड़े and I thought कि शायद brain tumor की surgery की वजह से हुए और फिर मुझे सिग्नेचर करने में प्रॉब्लम आने लगी बट continuously I thought due to a tumor surgery. But in 2015 January I diagnosed with Parkinson. And फिर स्टार्टिंग में तो सिनोपा स्टार्ट हो गई, इंक्रीज होती गई, धीरे धीरे प्रोग्रेस होता रहा. आफ्टर 1 year my leg started tumors. And उसके बाद 3-4 साल तो ठीक निकल गए और in 2021 I felt at night very problems. करवट लेने में बहुत प्रॉब्लम होने लगी, बिल्कुल बॉडी स्टिफ हो जाती थी और इतनी ट्यूमर्स भी बहुत ज़्यादा बढ़ गए थे, रिजिडिटी बहुत ज़्यादा बढ़ गई थी. एंड आई वाज टेकिंग 6 इंडोपास in a day, 1 Pramidol, SR 3.15 at night, and then थोड़ी सी प्रॉब्लम्स आई मुझे, नींद की प्रॉब्लम आई. 1 month तक बिल्कुल भी नींद नहीं आई मुझे एंड ड्यू टू मेडिसिन आई थॉट. तो कुछ और भी प्रॉब्लम्स आई. फिर 2 महीने बहुत अच्छा चला मेरा, काफ़ी खुश थी मैं और लेकिन सडनली हाथों में पावर कम होने लग गई. इतनी पावर कम हो गई कि मैं बाइक भी तोड़ नहीं पा रही थी. देन हमने डॉक्टर से कांटेक्ट किया, डॉक्टर मजूमदार से, तो उन्होंने कहा कुछ भी करंट में थोड़ी चेंजेस की और मेडिसिन्स मेरे को फिर स्टार्ट की, सिनोपा फिर स्टार्ट की, एमएनटी स्टार्ट की. तो अब मैं थोड़ा सा बेटर फील कर रही हूँ. अब मेडिसिन तो ले रही हूँ थोड़ी, लेकिन डीबीएस कराने के बाद रिजिडिटी इज ओवर नाउ. रिजिडिटी बिल्कुल खत्म हो गई है, रात को नींद आराम से आ जाती है और ट्यूमर्स बिल्कुल परफेक्टली गॉन. बट थोड़ी सी स्पीच में प्रॉब्लम आ रही है एंड आई एम डूइंग एक्सरसाइज फॉर दैट एंड इम्प्रूविंग.
सर आपको क्या लगता है? आप बोलिए. आप
सर मुझे तो
हाँ.
लगता है कि डीबीएस के बाद ये बहुत अच्छी हो गई. जैसे अभी डॉक्टर से बता रहे थे कि भाई इनकी प्रॉब्लम ये बढ़ गई कि भाई ये एग्रेसिव हो गए हैं, ये हो गए. मुझे लगता है कि मेरी वाइफ जो परेशान तो हो गई. तो मतलब पहले बिफोर डीबीएस वो कभी ना कभी कुछ मेरे से बात कर लेती थी ऐसी वैसी.
अच्छा.
बट आफ्टर डीबीएस कभी उन्होंने मेरे साथ एक्चुअली सो नहीं पाती थी ना पहले.
अच्छा. हाँ.
रात को करवट नहीं ले सकती है, सो नहीं पाती है, नींद
बहुत
पूरी नहीं
very
होती उनकी. अब ये कि साउंड स्लीप सोती हैं अपना 6-7 घंटे की. अगर सुबह भी उठती हैं तो अपना पाठ लगा लेती हैं कान में. अगर आधा घंटा पहले उठ गई हैं मेरे से तो अपना पाठ लगा लेती हैं कान में, तो वो अपना एंजॉय करती हैं. तो बाकी ये है कि जो मैं हेल्प कर सकता हूँ वो मैं इनके साथ करता हूँ.
तो आपके हिसाब से डीबीएस में इम्प्रूव हुआ?
हाँ, बहुत इम्प्रूवमेंट है सर, बहुत इम्प्रूवमेंट है. पहले हम लोग कहीं जा नहीं पाते थे किसी बैंक्वेट में खाना खाने या कहीं रेस्टोरेंट में. आज हम बड़ा फील ही चले जाते हैं कि चलो भी आज वहाँ जाना है तो अब जा सकते हैं. पहले नहीं तो वहीं एक भल्ला पापड़ी खाया और वापस आ गए, पता चला ट्रिमर स्टार्ट हो गए, सगन दिया और वापस आ गए, बैटरी ऑफ हो गई.
फियर जो वाला था वो फियर अभी नहीं?
हाँ, फियर नहीं है सर, अब बिल्कुल फियर नहीं है. अभी हम फर्स्ट टाइम, मेरा एक फ्रेंड आया ऑस्ट्रेलिया से, उसको हम मिलने गए एयर सिटी में, बड़ा अच्छा लगा मेरे को. अदरवाइज पहले इनको बोलता था कि मैं जाऊँगी नहीं. तो ये बहुत सारी इम्प्रूवमेंट आई है आफ्टर डीबीएस और बेटर है.
ठीक है सर, आप बोलिए.
I am Rajneesh Mahajan and I was directed DBS तो अभी लास्ट से कराया है, but Parkinson was diagnosed somewhere in the 10 to 12 years back. So during the this started with problem with signatures and right click of the mouse. मेरा जॉब ऐसा था कि I used to be working on computers, so मेरा right click बंद हो गया था. तो we went to a doctor and neurologist था मेरी onset of Parkinson disease. तो हमें इतना मालूम नहीं था कि Parkinson disease is such a fearful,
Such a disease.
such a fearful disease.
It is a very complex disease.
So complicated.
तो हम I was not aware of this. तो ठीक है Parkinson है, but slowly it started progressing, and I started having problems. तो मेरे को शायद सिंडोपाइड ने शुरू कर दी थी. Then I went to a doctor in Noida. He gave me Prenpex and stopped Syndopide completely. So it helped a lot. So that was one part of it. Then slowly उन्होंने भी Syndopide देनी शुरू कर दी. And last year December and January last year was very bad for me. I was taking about 7 to 8 tablets of Sinova in a day, और रात को भी खा के सोता था. I used to sleep after taking the medicine, and उसके बाद सुबह उठते ही फिर चालू. तो ऑफ एंड ऑन पीरियड जो थे वो चलते रहे. तो फरवरी में then we met Mr. Dr. Majumdar, and he explained the DBS in such a way कि I got convinced within 10 minutes. और जबकि 4 साल पहले तक मेरे को हर डॉक्टर जैसे मिलता था, they used to say कि DBS करा लो.
और हम लोग वहाँ से भाग जाते थे कि
And
हमको
we
कुछ
too.
आता ही नहीं है, यही एक ही बात बोलते हैं. हम लोग सोचते थे
We
कहीं
went to
और जाएं.
Artemis, we went
But he is
to
the person.
Apollo, we went to Fortis, almost सारे avenues जो थे, we
Obviously.
went and
Obviously, you want help. You were looking for help.
looking for
Somebody
help.
who can understand
Understand.
and then help.
February end में और March में I got operated for DBS, and pre-operative and post-operative there was a lot of difference. No risk. There was a dyskinesia, there was freezing, there was
Slowness.
slowness. Every post-DBS,
There is hardly.
freezing is gone. Slowness थोड़ी सी थी मगर वो medicines चलती नहीं, and tremors were gone. So it was just like कि जादू की छड़ी हिला दी किसी ने और things are totally changed.
No, it's a real game changer.
मैम आपको क्या लगता है सर के बारे में?
I am very happy. I am satisfied. डॉक्टर मजूमदार ने हमें प्रिपेयर किया था कि बिहेवियर चेंजेस बहुत आ जाएंगे, आप अपने आप को प्रिपेयर कर लीजिए.
You are very
बट
lucky.
मुझे तो कोई दिखा नहीं. मैं बल्कि वॉच करती हूँ कोई दिखे ऐसा कुछ भी नहीं हुआ. इन्होंने हमें बताया था कि अब ये हाइपर हो जाएंगे, आपके ऊपर ये करेंगे, आप पे रॉब डालेंगे, ये करेंगे, बट देयर इज नथिंग.
आप बताइए फिर, आपको कुछ बोलना है तो.
एक ही
But
Meet Mr. Majumdar. come and meet Dr. Pritam Majumdar. And
Yeah,
one
because
thing,
he is
one thing
qualified
about
by
you, Dr.
electromagnetic.
Majumdar, and I will say it on your face, you have immense patience. He listens. When you are talking, you have an issue, minor, major, stupid, silly. He will listen to what you're saying. That is so important. That is so important. No, I mean it. And I've been a practicing person for now from 82. I completed my internship, and I have seen the others. They are short, they are dismissive,
Yeah.
they have no time. They have no time. Even you've been all over. You've been to Fortis, you've been to Maths, you've been to
Yeah.
Artemis. They don't have time.
We've been to
But he
AIMS.
listens.
इनको तो रात को 12 बजे हमने मैसेज किया है
नहीं ये तो
और उनका
ओपीडी में
reply
आके
आया।
ओपीडी में आके बैठो तो सुनते हैं बात सबसे बड़ी बात है You know,
रात को 12 बजे मैसेज का रिप्लाई
Very
करते रहते हैं
essential.
it is very important because
But देखिए मेरी बात सुनिए दूसरी what I want to say as a for sake of repeating the Parkinson everyone told us the Parkinson disease is not going to stop the
Yeah.
progress is
No,
not going to
that was
stop
not.
and you want to link everything to DBS is also not correct disease तो चलना ही है ना
बिल्कुल
DBS के जो 3-4 फायदे हैं वो इमीडिएटली हो गए ऑप्शन चली गई रिजिडिटी चली गई स्टिफनेस चली गई ट्रेमर चले गए
बिल्कुल
which
बिल्कुल।
is remarkable. As I was telling you, electrical current किसी को नहीं पता क्यों होते हैं पर हो गए हमें क्या लेना है कि पता कि जिसको नोबेल प्राइज लेना है वो करता रहेगा काम करता रहेगा ना what I'm trying to say कि और इसमें कोई ये
He gave us a book which was clearly. So in that book, it was very very clear कि how the procedure is done and what to count for कि होगा और what to not count for कि जो चीज नहीं होगी.
नहीं होगी, सब क्लियर था।
Everything was clearly written in that book.
हमारे
तो-
फैमिली मेंबर्स ने जो हैं पढ़ी, सबने पढ़ी, फिर उन्होंने हमें कहा कि अब आप करवा लो।
कि देखिए ऐसा वेग सर्जरी लोग डर जाते हैं
ब्रेन कहने से तो
ब्रेन तो क्या है एवरी पार्ट इज इक्वली इम्पोर्टेंट एंड योर ब्रेन आई एग्री
बड़ा डर जाता है.
डर जाता है I don't know.
सर आपका टेक होम मैसेज क्या रहेगा?
My take home message is that for each patient, if they have been advised by a team, go ahead, it is a game changer. And because you got a window opportunity, everybody is not fit for a DBS. You've got to have a good cardiovascular status because you have to undergo this surgery. It's a big surgery, so don't miss the opportunity if you have been advised. And if you have the window opportunity is already gone, you can't help it. And it's a wonderful surgery. It is really